This is a very brief video on dysfunction of the lumbopelvic hip complex, and we're going to discuss a common pattern, the most common pattern of lumbopelvic hip motion dysfunction. We've covered dysfunction prior in video number 2 with a brief introduction, and of course in discussing function. And it should be very intuitive as to what dysfunction is, but dysfunction can certainly represent a pain pattern, and that's covered in a separate section. Typically pain in the region of the SI radiating into the buttock can refer somewhat down into the lower extremity, but certainly is not lancinating sciatica. And it sometimes can refer to the trochanter in the inguinal area. It's a movement dysfunction, as we cover with the spring test section of the workbook. In discussing the most common pattern of lumbopelvic hip dysfunction, the pattern in the pelvis is very similar to how the pelvis would orient with a right to left golf swing. So we're going to pretend that I'm holding a golf club, and we're going to pretend that I'm a golfer, which I'm not, and we wind up and then we twist to the left, and you'll notice that my heel is rising up, and you'll notice my right knee is bent, and that's very important. The pelvis twists in a three-dimensional manner, orienting to the left. It's as though the pelvis has moved in a corkscrew manner in which the right side comes down, but the left side twists superiorly. And the pattern in the pelvis is reflected also in the hip and in the sacrum and in the pubic structure. So you can imagine if the right pubic structure were to come anterior or the left posteriorly, that would fit in the most common pattern. Now, that probably doesn't happen with many golfers, so that is more of a postural presentation rather than a true glide in the joint. So that's one caveat. Most people who have the most common pattern have lost normal internal rotation of that right lower extremity. And so you can see that this right hip is actually positioned in external rotation. And they tend to get tight in all their hip rotators on the right, the external rotators. You'll notice that the pelvis does glide to the left, okay? And you'll notice that the spine side bends to the right. However, the pelvis does present in a left side bending pattern, and that is initiated with the planted left lower extremity. So what we see in the most common pattern is, and again much of this is a muscular pattern of pelvis moving on the hips, but we see greater tone in the paraspinals over the left side of the sacrum blocking movement, appearance of left rotation of sacrum about a vertical axis, and left side bending. So once again, this golf type maneuver induces side bending of the pelvis from below, whereas in the lumbar spine above L5 there is a right side bending pattern. And there's also this transverse plane rotation of the pelvis, which is named right in flare, left out flare. And I truly don't believe that's a pattern inside the joint itself, but that is rather pelvis twisting in relationship to the hips and to the trunk. And L5 is so connected to the sacrum, there's very little rotational and side bending mobility available in those joints, that L5 follows the sacrum. And so in this pattern, it appears as though the sacrum has rotated left and side bend left. L5 tends to follow that pattern. We'll talk about exceptions to that based on facet trophism in the section on L5S1 mechanics later on in the book. But this basically describes the twisting pattern, the most common pattern of lumbopelvic hip complex is very similar to a right to left golf swing, in which the right hip external rotators are tight, pelvis is side glided to the left habitually, and it lacks left to right side glide. If there is a shift in the pube, then it is a posterior shift with a distinct step off. Otherwise, the person on the table does lie with their pelvis oriented left, and if there's not a true step off, at least posturally, it looks as though the left were lower than the right. But by crossing across one pubic bone to the other, you get to discern if there's a step off or if it's simply the entire pelvic posture. In prone, the sacrum appears to be left rotated, so that's a fit. Also appears to be left side bend. Right ilium appears to be rotated anteriorly, and that's a triplane phenomenon. Left ilium appears to be posteriorly rotated, and then there is this transverse plane phenomenon, which would be a right in flare and a left out flare. And then L5 would follow that pattern. The body counter-rotates for that very far away, and in most individuals the counter-rotation is very high, up at the occiput C1 and C1, C2 region. And we note that in those presentations that balancing the lower body in terms of mobility, giving freedom of fairly symmetrical mobility both directions, restoring that person's norm, induces a reflex release of the holding pattern in the upper cervical spine. So this is all that I care to say about the golf pattern, other than the fact that if you think of that pattern, it will help you to memorize and visualize the most common pattern. Thank you very much.